The health of Guyanese is of paramount importance to the coalition government. Paul McAdam tells us that for 2018, $33.3 billion was allocated to the public health sector, and much has been accomplished thus far.
For 2018, this is reflected in the sum of $33.3 billion budgeted for the public health sector. This budget was 12.5% of the national budget and 4.2% of the gross domestic product. This was an increase of 7% over the $31.2 billion allocation in 2017. In 2016, $28 billion was budgeted. Expenditures included $2.8 billion for the upgrade, maintenance, and construction of health infrastructure countrywide, including $150 million for the rehabilitation of the C.C. Nicholson Hospital on the east coast of Demerara. $600 million was set aside for the procurement of medical equipment and $2.2 million for drugs and medical supplies. Millions were also allocated for the 2018 Elderly Health Program, offering a package of care services for the elderly. Specialized doctors and other personnel were deployed across the regions, reducing the need to refer our Medivac patients to the Georgetown Public Hospital Corporation. Operationalization of the computed tomography or CT scan machine at the New Amsterdam Hospital in Region 6 was also done.
We find that half of our transfers to GPHC is because of injury to the head. We cannot diagnose and treat here because we did not have a CT scan machine. But now with that being in place, we'll be reducing the number of transfers to GPHC, hence providing better services to the residents of East Berbice quarantine.
Funding was also used to train at least 500 healthcare workers to treat those affected by mental illnesses. A viral load testing machine to conduct Zika, HIV, and other specialist screenings was also obtained. Investment was also made in a second mammography machine for the Georgetown Public Hospital Corporation to boost screening and early diagnosis of breast cancer. Minister Lawrence highlighted the government's move to boost public health at the launch of the inaugural Health Expo held from May 30 to June 2, 2018. She said the idea had the potential to foster intersector movements towards improving the healthcare system.
Where our health status can impact significantly on the reduction of NCD risk factors, and more importantly, where you can influence and play a pivotal and integral role in helping the ministry to achieve its mandate and the SDGs, particularly SDG number 3.
The government is also keen to realize the National Health Strategy titled Health Vision 2020. This covers universal access to public health coverage, universal primary health care, and preventative health care. Paul McAdam for InfoHub.